Thank you for giving me the opportunity to make this presentation. We have nothing to disclose. Laparoscopic surgery has been permeating to even elderly patients now. We conducted a randomized study between open surgery and laparoscopic surgery in elderly colorectal patients from 2008 to 2012. We reported the favorable short-term result of laparoscopic surgery at SAGES 2013. Almost short-term results showed a favor in the laparoscopic surgery, except the operative time. The purpose of the present study is to clarify the long-term outcomes of the laparoscopic surgery for elderly patients with colorectal cancer. This study was a randomized control trial conducted in a single institute. 200 patients were allocated to laparoscopic surgery or conventional open surgery randomly. The inclusion criteria were here. Patient age was 75 years or over, histological proven adenocarcinoma, clinical T4A or lower T factor, M0, and elective operation. Exclusion criteria were here: double cancer, multiple cancer, intestinal obstruction or perforation, bulky tumor rather than 8 centimeters in diameter. The strategic factor to allocate was tumor location, right colon, left colon, or rectum. In the present study, long-term outcomes were compared: overall survival rate, disease-free survival rate, recurrence-free survival rate, cancer-specific survival rate, recurrence, cause of death. These were analyzed in the subgroup analysis, TNM stage, and the tumor location. A clinical pathological risk factor for the recurrence was analyzed by multivariate Cox regression analysis. Result. This is a CONSORT diagram. 9 patients, open was 7, laparoscopic was 2 patients were excluded because of an intraoperative diagnosis of metastases. 1 patient was excluded from open because he had a malignant intestinal lymphoma. Therefore, 92 patients who underwent open and 98 patients who underwent laparoscopic surgery were analyzed. This is a patient characteristics. There was no difference in TNM staging. There was no difference in patient characteristics between the groups, excluding one pathologic findings. The patient with vascular invasion of the laparoscopic group was more than the open group in the analysis of rectal cancer. The 5-year overall survival rate was 79% for open and 82% for laparoscopic surgery. There was no significant difference. There was no difference at any TNM stage and tumor location. In the 5-year disease-free survival rate, open was 70% and laparoscopic was 63%. Did not show a difference between groups. In the 5-year recurrence-free survival rate, open was 76%, laparoscopic was 72%, did not show a difference between groups. In the 5-year cancer-specific survival rate, open was 86%, laparoscopic was 80%, did not show a difference between groups. There were no differences at any TNM stage and the tumor location in DFS, RFS, or CSS. The overall recurrence rate was 13% after open surgery and 20% after laparoscopic surgery, and there was no difference between groups. However, there were strong tendencies for recurrence on distant lymph node and local recurrence at laparoscopic surgery, although no significant difference were detected compared to open surgery. In the analysis of risk factor for recurrence, vascular invasion, lymph node metastasis, and rectal cancer were identified as risk factors. There was no difference in the causes of death between open and laparoscopic surgery. More than half of the patients died from other disease in both groups. The strong tendency toward local recurrence after laparoscopic surgery is an important problem. All cases were rectal cancer. The patient with vascular invasion of laparoscopic group was more than the open groups in the analysis of rectal cancer. A lot of vascular invasion might be why there are more recurrence in the laparoscopic group. The present study had several limitations. The end-order sample size was unavoidably small because this was single study. If the inclusion criterion was limited to colon cancer, any differences in the long-term outcome might not be detected between groups. A larger study of rectal cancer surgery in elderly patients is needed to clarify the efficacy of laparoscopic surgery for this degeneration. In conclusion, laparoscopic surgery showed a similar long-term result compared to open surgery in elderly patients with colorectal cancer. Laparoscopic surgery is an effective surgical procedure for elderly colorectal cancer patients, especially those with colon cancer. This is a visual abstract. Thank you for your attention.